Welcome to Academics in Nutshell, and today's topic is culture of cultures. To start with, blood culture, where timing is most important. Blood should be collected as close to the onset of fever and chills as possible because the bacteremia increases with the chills, and fever and chills actually signifies bacteremia. So timing is very important, as is the number of sets. Sets means one venipuncture site. So 2 sets is always preferable. 1 set, the yield is about 73%. With 2 sets, it goes to 94%. And if possible, 3 sets, it's 97%. Then comes the volume. We have to remember that the blood to broth ratio should be about 1:5 to 1:10. But in neonates, even 1:50 or 1:100 is acceptable as their bacteremia is much more. Volume wise, usually 1 to 3 ml is sufficient, but there is also a calculation as the blood volume recommended increases as the weight increases. Most importantly, the collected blood should be transported to the lab in room temperature, and that is preferably within 2 hours, and it should never be refrigerated. Now, we should practice the culture of blood culture definitely before starting antibiotics, but even if the child is on antibiotics, then a culture sample should be sent. Backtake, usually the growth is observed within 3 days, but to declare it negative, we may have to wait for 5 days. CSF culture, the drawing of CSF position is important. The space should be preferably L3, L4 in between, or L4, L5 if required. Usually the Spinocane needle is used. We should be careful that the CSF should drain freely in drops, and it should never be aspirated. The sample should be collected in 3 tubes, and the initial few drops are usually for cytology. The quantity 3 to 5 ml is sufficient. There are only few contraindications of LP, like the cardiorespiratory failure or infection in the site of aspiration, and raised intracranial pressure is a relative contraindication. A blood in CSF, well, if there is initial blood stain, one may go for 1 step above with the first needle in situ. The transport should ideally be within 30 minutes. If there is delay, it may be stored in 2 containers. Again, it's recommended to be stored at room temperature at around 37 degrees centigrade, and imaging is never a substitute for CSF examination. Collection of urine for culture, definitely the genitalia should be washed in water, and antiseptic washes, forced retraction of prepuce are not advised. The non-invasive method of collection like nappy pad and urine bag have their limitation. If the child is toilet trained, then a clean catch is preferable. In some circumstances, the invasive methods like catheter or suprapubic may be done in a child if required. Again, it should be transported as soon as possible within 1 hour after voiding at room temperature. But if it has to be stored, then it may be stored for up to 4 hours in refrigeration. So thank you. See you again.